Hello, my name is Kevin Taylor. I'm a longtime family physician and I have taught medical students for a long time, including techniques of surgical knot tying. The purpose of this video is as a tool for you to learn the simple process of surgical knot tying. Surgical knots are used intraoperatively, usually to tie off a structure such as a vessel or a duct, or to attach or tie to a tendon or fascia. Surgical knots are usually done with free ties, which are suture material without needles. Intraoperatively, the surgeon usually passes the free tie around the structure or through the structure, and then you as the assistant would tie it off. This is a simple process, most simply done using a two-handed technique. However, there is a one-handed technique that we'll demonstrate that can be used anytime, although it does require a bit more practice. One-handed surgical ties are most helpful in the presence of deep surgical fields where there isn't room for two hands, such as a deep pelvic surgery or deep abdominal surgery in the presence of obesity. For the purpose of demonstration, today we'll use a thick string, but you could practice with shoestrings as well. As you become more skilled, I encourage you to try to acquire some free ties that might be outdated from a local OR or from a friendly surgeon. Surgical knot tying is basically a series of square knots. It's that simple. There are different methodologies of how to accomplish this that you might see online demonstrated in a slightly different technique, but if you learn the technique that I show you, it is very foolproof. As with any skill, this will become easier and easier as you practice, and I encourage you to stress accuracy rather than speed. Speed will come as you get better and better at this. For purposes of directing the free tie and how it goes over a finger as you're tying it, I'll use a reference to radial or ulnar side of a finger, for instance. Okay, let's go ahead and get started. First, I'll demonstrate the two-handed tie technique. This is the starting position with a suture draped over the palms, radial to ulnar, and the loose ends toward you. Then you reach over with your right hand, drape the suture over the index finger, ulnar to radial, in this manner. Then I like to make a little pincher grasp with the thumb and index finger. Reach backward through that gap, grasp the suture from your right hand and pull it forward through that gap. And grasp with your right hand and you're ready to pull it down. Well, you can see in this case, the suture is kind of twisted. You want to pull it down this way so it lays flat. That's called pull it down square rather than twisted. So you pull it down square, snugly. Next step, you drape the suture over your thumb, radial to ulnar. Then with your right hand, you drape that right-handed suture, ulnar to radial over the thumb. Again, pincher grasp. On this time you come forward, grasp the suture from your right hand and pull it backward through the gap. Grasp with your right hand and you're ready to pull it down. There's your first square knot. Nice square knot. Repeat. With the left hand suture draped over the index finger, radial to ulnar. Bring your right hand over the index finger, ulnar to radial. Pincher grasp. Go back through the gap, grasp the suture from your right hand, pull it forward. Grasp that with your right hand, pull it down square, which means you'll need to pull it off to your left. Then over the thumb, radial ulnar, drape it with your right hand, ulnar to radial, pincher grasp, come forward, grasp the suture, pull it backward through the gap, and you're ready to pull it down, and there's your second square knot. So as you get a bit faster, you go over index finger, thumb, index finger, thumb. So literally you're pulling right, left, index finger, thumb, index finger, thumb. And you see the nice, neat, tidy rows of square knots here. Next, I'm going to demonstrate a one-handed tie using the right hand. You hold it differently, draped across the palm, ulnar to radial, with the end away from you. Then you bring it to the stationary part of the suture between the second and third digits. Curl your third and fourth digits towards you, grasp the suture and pull it back through the gap. If you're working in a deep surgical hole or surgical field, you'd press it down until it's snug. Then bring it up over your index finger, radial to ulna, bring it up to the stationary suture, push down with your thumb so you can curl your index finger, snag it with the back side of your index finger, and pull it back through the gap. That's your first square knot. Repeat. Bring it between the second and third digits, curl your fingers forward, grasp it, pull it back through the gap, pull it down, over the index finger, push it down with the thumb, curl your index finger around, pull it backward through the gap, and there are your two nice surgical square knots. And you can just keep repeating in that manner. There you go. Nice, neat square knots. Next, I'd like to demonstrate a left-handed single-handed tie, which of course is an advantage to left-handed people. But there's an advantage for everyone to know how to do both left and right-handed single-handed ties, because there can be times intraoperatively when your left hand is the only free hand for a tie. Again, you'd start in this position with the suture draped over your left hand, palmar, the tip away from you. You bring it up to the stationary suture between the second and third digits. Reach across anteriorly with the third and fourth digits, and you pull it backward through the gap. Push it down with your finger in the deep operating field. Then come up with the suture draped over your index finger, radial to ulna. Bring it up to the stationary tie, push down with the thumb so you can flex the index finger, snag it backward through the gap backwardly in this manner, and then pull it back. And there's your first square knot. Repeat. Brought up to the stationary suture between second and third digits. Flex third and fourth digits forward to grasp the suture. Pull it back through the gap. Then over the index finger, radial to ulna. Bring it up to the stationary suture. Push down with the thumb so you can flex the index finger, snag it with your nail, and pull it backward in that manner. And there's your second square knot. And then merely repeat. And you have a nice, neat, tidy row of square knots. I hope you find this training useful. The more you practice, the better you'll be. And so when the surgeon says, "Can you tie that off?" you can say, "Yes, sir," or "Yes, ma'am." And you'd like to get to the point where the surgeon says, "Wow, you're good surgical help." And that would be a great kudo to you. Wish you well.